I invite you to watch this movie. Hello, let me talk to you further about feeding infants. The infant should not be given any spicy food or food in which salt, sugar or artificial colors are added until the age of 8 to 9 months or even up to 1 year. Also, fruit juices and cold drinks are prohibited. Cornflakes, popcorn, dry biscuits, creamy biscuits, etc. are avoided. Nuts, chocolates, candies, etc. can choke the baby and should not be given to the infant. Normal flora in the newborn's intestines are not fully formed to combat some bacteria like the spore-bearing botulinum, and therefore to prevent botulism, do not use honey. Instead, use the expressed breast milk. If there is need to give tablets, then the tablet is crushed into powder and mixed in milk expressed from the breast. Honey may be given at 1 year of age or thereafter. There are some foods that may cause allergy to the baby, most commonly eggs and fish, shellfish, tomatoes, onions, berries. Do not give any food that is kept in the refrigerator for more than 3 days. Never leave your baby unattended. Water is most important to live what we consider a healthy life. If we can manage to drink only the best and cleanest water and eat fresh, clean food all our life, then we can be sure to cut more than half of our illnesses. Most of the infants that die are dying because of water-borne infectious and parasitic diseases. It may be a good idea to boil the water to remove any organisms and cool it before drinking. If we install a water purifier which works on electricity, then we can collect and store clean water in bottles. Eating in restaurants and from street food carts is risky, and we do it only when absolutely necessary, so that we save ourselves from water-borne diseases. Therefore, the government health department should be extra careful to see that these places take all precautions in preparing and supplying food to the public. It is a good practice to wash hands after going to the toilet and before eating. This will lead to a great reduction of people suffering from water-borne diseases. Also, it is important that we use clean plates to eat our food in. Diarrhea is without blood. Dysentery, loose motion with blood. Diarrhea with or without blood in stools is the most common health problem in children and also in adults. When a person has diarrhea and vomiting, he can become dehydrated rapidly. He needs urgent treatment. A glass of water with a pinch of salt and a spoon of glucose powder stirred in it is given to the person to drink little by little. By spoon if necessary, as frequently as possible, especially soon after the child vomits. Dehydration requires urgent treatment to make up for the lost fluids in the body. This is a ready-made oral rehydration salts powder available in the pharmacy. Village health worker can help the people living in villages if he or she knows how to treat the diarrhea and dysentery conditions of the rural people. Sometimes the patient is so weak that admission in a nursing home may be required. Also, to control diarrhea and vomiting, admission in a nursing home may be required so that intravenous fluids and other drugs can be given. Laboratory investigations may also be necessary for proper treatment of the loose motion. Among the waterborne and foodborne diseases, the parasite amoeba is important because it is difficult to diagnose. Microscopic examination of a stool sample may be necessary. Collection of the stool sample for test is very simple. A small amount of stools immediately after defecation is collected and wrapped in a plastic sheet. Or it is placed in a container. There is no need of any preservative because the test must be done within 2 hours. In the laboratory, the stool sample is examined under the microscope. In the case of amoebic dysentery, the cysts and the vegetative forms are found. That is, the moving forms. There is blood and mucus in the stools, and the patient suffers from diarrhea, loss of blood, and dehydration. Often the infestation is chronic, that is, has been for a long time. Chronic amoebiasis is likely to affect other organs such as the liver, where it can form an abscess. Diagnosis of a liver abscess is frequently delayed unless suspected. Unless the doctor is suspicious of the possibility of the amoebic liver abscess, the fever and the weakness that the patient comes for may be misdiagnosed and specific treatment may be delayed. A more serious complication of chronic amoebiasis is pneumonia of the right lung and also fluid in the pleural cavity with collapse of the lung. Amoebic liver abscess requires surgical treatment and therefore the patient needs to be hospitalized. The second important disease is malaria. The mosquitoes that carry the malaria breed in stagnant water. They grow and multiply in stagnant water. If stagnant water is made to flow out properly, then malaria can be prevented. It is necessary to protect the babies and young children from mosquito bites, and therefore it is advisable to cover the body as much as possible by using mosquito nets when they sleep and use coils, liquid, mats, lotion or cream to prevent mosquito bites. There are many varieties of malarial parasites, but one of them, the Plasmodium falciparum, can attack the brain and cause death. High fever and chills require examination of blood for malarial parasites. Death is preventable if early treatment is given.